Hi, so this is Adrienne Ammerman with WNC Health Network, and I'm talking with Lindsay and Emily today about a project they've been working on together. So, Lindsay and Emily, let's start with some introductions. If you could both just say who you are and tell me a little bit about your role at your agency and the kinds of things that you do day to day. Emily, do you want to start with you?
Sure, I'm happy to start. So I'm Emily Kajawa. I'm the project manager and improvement specialist at WNC Health Network. And I do a variety of things, but I would say a big part of my role is focused on supporting organizations and groups in communities across the region, do collaborative planning, figure out how do we work together and do work together collaboratively in a way that's really results focused, that's data driven, that's engaging the community and people who are most affected by the issues that these groups are working on together. And this means a lot of my day to day is meeting with people and organizations and groups across the region to co design meeting agendas, facilitate community listening sessions, which we'll get to talk about today, design surveys, offer technical assistance to help build capacity within communities to do this kind of work on their own.
Great. What about you, Lindsay?
Hey, Lindsey Henderson. So I work for the Eastern Band of Cherokee Indians Public Health and Human Services Division. So my primary role is emergency preparedness, but another role of mine and something very dear to me is facilitating the tribal health improvement process with the THIP planning team and the steering committee. I really love community health, so being part of this process is really fun and exciting for me.
Awesome. Lindsay, tell us some of the background about this project.
So this was a grant with NACHO, and we kind of to renew our tribal health improvement process. We kind of paused for a while during COVID. And so this grant was really a great way to kind of get back in the swing of things as far as that goes and to collaborate with some of our partners and definitely the community.
So tell us how you chose to do community listening sessions as part of this project.
So community voices, community experience, community knowledge, it's all very powerful, and it's really just a great way to enhance the way we understand and the way we address health in the community. So listening sessions provides a really great opportunity for that.
So what made your team decide to reach out to WNC Health Network for support?
Yeah. So we have worked with Health Network in the past for our tribal health improvement process, our tribal health assessment, and I know several other things. And we really love working with you guys because you are regional experts in community health. And like Emily was saying earlier, you guys are um, really great when it comes to planning and, and facilitation and just any other technical support.
What kind of support were you looking for specifically?
Um, Initially, we weren't sure, other than we knew we wanted Health Network to help us on this project. Um, but as it turns out, Emily and her team, they were really great in helping make sense of my ideas. I had a lot of things, going on up there, and talking to Emily, they really kind of was put me in the right direction of, okay, this is what it sounds like you're thinking, what you want to do. Uh, you guys helped me develop material, especially the community listening session questions, which I love those community listening session questions that we created together. And Emily also helped facilitate the listening sessions, which was just a huge support to our team because the FIT planning team is a small team. So
Great. Emily, tell us a little bit about how this partnership worked from the health network's end. Do you have anything to add about the support that you and the team provided?
Um, yeah, well, mutual, just so much appreciation, Lindsay, for you and your team and all the work that you all do to support the tribal health improvement process. It's really amazing and inspiring. Y'all have been able to keep it going and revive it, in the middle of and post pandemic. But I'll just say I was so excited to get this request from y'all. Love working with y'all and really support this important process. I would say we met pretty regularly early on. Lindsay, would you? Yeah.
Yeah.
We met pretty regularly for a while to try to clarify, get more clarity around. There are so many possibilities for the direction that this project could have gone. And so it took a lot of kind of thinking together and you all thinking about, well, what do we, what are the opportunities for this project to also support where we're at with the tribal health improvement planning process. So I think, yes, just a lot of getting clarity early on. And then, as Lindsay mentioned, just the co-designing the question guide. I also really love that guide. It's pretty
What do y'all
great.
love about it? I'm hearing a lot of love for this question guide. What was it that
Well,
sparked the love?
what would you say, Lindsay?
For me is um, a, a lot of material that we see is not tailored towards tribal communities. And so working with Emily, we really got to talk about, well, what kinds of questions should we ask the community? Um, and and in the same sense, like what kind of questions are we going to get? What kind of questions can we ask to get the best information from? We really wanted these questions to be easy to understand, but also have very intentional answers. And just in the way we designed it, we talked a lot about our Cherokee culture, our Cherokee language, our Cherokee traditions in there. So it was really beautiful just to see that come together. Typically, in a lot of meetings, we have these icebreaker questions. And this was my favorite question just because I love it. But the question is, what are you proud of about your community or specifically EBCI? And so I think that was a great way for us just to open up, start with something positive. And I think that really says a lot about the person and the community in answering that question too. So it was just beautiful.
Aw. Well, Emily, how does that makes me just think, how does this align with the health network's values and approach for how we work in the region?
Yeah. I mean, I feel like as an organization, we feel it really matters how collaborative planning and process efforts, community engagement efforts happen. And there's a lot of nuance within that how. And I think, our team aims to embody certain values in all of our partnerships and efforts. Community, meaningfully engaging community is a really core piece of that. And I think that's a big part for me of why this partnership with you, Lindsay, and your team felt like such a great, just really well aligned with, there was a commitment to really lifting up community voices and bringing them to a planning process that that matters. And so to me, that felt like a huge piece of why this was, this partnership was such a great aligned fit for us. Yeah.
Nice. Well, Lindsay, I'm curious, what's next? How do you plan on using what you've learned so far?
So I'll start by saying that Emily and her team, they facilitated a consensus workshop. to help summarize themes and key findings to basically answer the question, what does health equity mean and what does it look like in EBCI? And that's really important to us. And for me, the way that I see this panning out is that it contributes to a shared community understanding, firstly. And then we plan to incorporate those findings into our THIP teams as we develop strategies for our 4 health priorities. So, as we understand our community and health equity, we can also look towards what works best for our community in that way.
Well, any words of wisdom for other local organizations or agencies that want to engage their communities in this way?
One, I would say just anytime you have an opportunity to do listening sessions or any other form of community engagement, absolutely do it. Um, and what I really love about community listening sessions is that for us, storytelling is such a vital part of tradition. And two, it allows that face-to-face interaction. I think Emily was talking a little bit about data in the beginning of the conversation. So this community sessions is listening sessions is a really nice way to take a step back from technology and the way we are used to gathering data. And two, just to piggyback off of that, story data is just as important as number data, and sometimes offers a different lens to what we think we know. So I definitely just encourage communities or local health departments to look into community listening sessions and to really engage their community. It's worth it.
Well,
And
thank you. Oh, sorry. Go ahead, Emily.
I was gonna say, just one thing I'll add to that. I totally resonate with that, Lindsay. And one other thing I'll add is, I think something I've learned with these listening sessions and other sessions I've supported over time is that there's a real opportunity with community listening sessions for them to be trust building with community members. And so being really intentional and clear about who's asking these questions, who's going to see this data, who's going to use this data. We will keep you in, like if you want to continue to be involved with this process, we invite you to continue to be involved. So just, thinking about some of those nuances of the experience of people who participate in the listening session, and they have a real opportunity, they present a real opportunity to build trust and deepening relationships with people in the community.
Well, thank you so much, both of you, for sharing about this experience and for the work that you're doing.
Thank you, guys.
Thanks, Lindsay.